Grab your foam roller. Come to sit on it for a glute med release. Crossing one ankle over top of the knee, dorsiflexing the foot. Whatever leg is over top, you're going to lean into that glute, placing your hands behind you for leverage. You'll inhale, pull your abs in towards your spine, brace those muscles that stop your stream of pee, and exhale the air out the mouth as you dig into that fascia, opening up that outer hip. Breathe in, pull the belly button in, keep the sternum reaching towards the back ribs, and exhale the air out. Again, inhale. Pull in on the muscles that stop your stream of pee, in and up. Hold that lift, sternum reaching towards the back ribs. Exhaling it out, sustaining that lift with the pelvic floor. Go ahead and switch sides. Setting up on the other side, make sure that the foot that's crossed over is dorsiflexed. This helps with the knee traction. Use your elbows or your hands behind the glutes. The fingers can be facing the buttocks or out to the side, but they shouldn't be facing back because that's not great for the fascia around the elbow. So make sure you're breathing here. Inhale, pull the belly button in, lift up on those muscles that stop your stream of pee, and fog a mirror with your exhale. Inhale, we're contracting the transverse abdominis every time we pull the abs in and tug up on those muscles that stop the stream of pee, and we sustain it. We contract the deepest layer of our core. This will help alleviate chronic back pain and deeply condition the innermost muscles of the abdominals. One more breath here. Inhale, pull the abdomen in towards the spine, hold it in, lift up on those muscles that stop the stream of pee, and fog a mirror with your exhale. We'll come off the roller, setting it to the side, grabbing our anti-burst ball, coming to lie supine, placing that ball underneath the sacrum, bringing our pointer fingers to the bony protrusions of your hips and guiding them down, creating lumbar extension, and then tipping them back to neutral pelvis. Let's connect this movement of the pelvis with the breath, exhaling to tip the pelvis down into low back extension, arching the low back, bracing the abdominals, and then inhaling, breathing laterally into the rib cage to tilt the pelvis back to neutral. Exhale, brace the abs, tipping into extension. Inhale, bringing the pelvis back to neutral. Keep going with that. Make sure your rib cage isn't pressing out, that you're thinking about the sternum reaching towards the spine, the back ribs pressing into the floor. You're thinking about the bones of your big toes heavy on the floor so you're not rolling out on your feet. We want to combat the tendency to supinate that we see with sway back posture. A couple more pelvic tilts here using your breath. After your last one, I'd like you to set your arms down by the hips, pressing them into the floor, activating your arm extensors, triceps, wrists, hands heavy. We're going to float one leg up into butterfly. We'll be doing butterfly press outs on a 3 count, staying on one side with the other leg down, pressing heavy through the bone of the big toe with the leg that's down. Brace the abs as you press out. 2, 3. Inhale, bring it in. 2, 3. Brace the abs. Exhale, press out. 2, 3. Inhale in. 2, 3. Make sure the rotation of this leg, and you can continue going, is from the top of the hip socket and not from the knee or ankle. We don't want to aggravate the knee. And as you press out, you'll feel the hip flexor and the lower abdominals working. Bring it in. 2, 3. 2 more on this side. Exhale out. 2, 3. Inhale in. 2, 3. Last one on this side. Exhale out. 2, 3. Inhale in. 2, 3. Lowering that leg down. Setting up on the other side. Brace your abs to lift the other leg. External rotations from the top of the hip socket. Bone of the big toe of the foot that's down is heavy. Sternum is reaching towards the back ribs. Tailbone is reaching away from you, so you keep lumbar extension, but always remember the bracing of the abs as you press that leg out Inhale to pull back in. Keep moving on the breath with the tailbone reaching away from you towards the bottom of the mat, towards the legs, and the sternum reaching towards the spine and the back ribs heavy in the mat. Pressing into the mat, chin retracted, double chin to lengthen the back of the neck and turn on the neck flexors, the weak muscles in front of the neck. Exhale as that butterfly position presses forward. Inhale as you bring it back in. From here, we'll bring that leg down after you finish your last one. Lifting the pelvis up, sliding that ball out. We'll anchor our lightest Theraband, tying it to our foam roller. Coming onto our knees on the foam roller with the ball between the knees. Setting up for lateral flexion. We're loading our bottom arm. We'll do a 2-breath isometric hold. Side bending, keeping the ribs close, sternum reaching towards the back ribs, adding the bottom arm, palms facing in, framing the face, chin retracted or turned down to keep the back of the neck out of it. Inhale 1, breathe. Exhale 1. Inhale 2. Exhale 2. Inhale, brace the abs and bring yourself back upright. Continuing side bending, adding the bottom arm. Inhale 1, breathe. Exhale 1. Inhale 2. Exhale 2. Inhale, abdomen in, contract those abdominals. Exhale, coming back up to center. One more set. Side bending on your inhale, adding the bottom arm on your exhale. Reach the sternum towards the back body, pull the navel in towards the spine, tug up on those muscles that stop your stream of pee. Fog a mirror with your exhale. Inhale, brace the abs. Exhale. And inhale, brace the abs, coming back upright. Go ahead and come off the roller. Switching sides, setting up for lateral flexion on the other side. Side bending, inhale. Add the bottom arm, exhale. Hold, inhale 1, plug the shoulders down the back, exhale 1, retract the chin, inhale 2, exhale 2, inhale, sternum reaching towards the back ribs, exhale, brace the abs, come back upright. And side bend on your next inhale, add the bottom arm, exhale, inhale, brace the abs, and exhale. Inhale, pull the navel in, lift up on the muscles that stop your stream of pee and fog a mirror as you come back upright. And last time on this side, side bending over, adding the bottom arm, bracing the abs. Inhale, brace, retract the chin, exhale. Inhale, shoulders down the back, brace, exhale. Expanding the side body, inhale. Pulling the navel in, lifting up on the muscles that stop your stream of pee, fog a mirror as you exhale. And lift all the way back up to center. Coming off the roller, setting it to the side, grabbing our heaviest Theraband. Ball will be between the knees, feet will be dorsiflexed, band around the arch of the feet. We'll hinge back with a tall, flat back from tailbone out through the crown of the head, sternum reaching towards the back ribs so you're not pushing your rib cage forward. And we'll do some bow and arrow twisting at the bottom. Inhale, exhale, twist, 2, 3, 4, pause, inhale, brace the abs, back up to a tall spine. Dorsiflex feet, heels digging into the floor, squeeze into that ball, tailbone, all the way out through the crown of the head, long energy line. Keep going. As you twist on your exhale, pause to inhale, brace the abs to bring yourself back upright. Use your breath here. Remember, the movement is on the exhale. We have a pause on the inhale, breathing laterally with awareness of what's happening in your pelvis. Your tailbone is driving down, creating lumbar extension with the support of the abs being pulled in and the pelvic floor muscles being lifted up. You're doing great. Continue with that inhale. Pull the abs in. Lift up on the muscles that stop your stream of pee as you hinge back with a tall spine. No rounding in the lumbar. Tailbone reaching down and away from you. Belly button reaching in towards the spine. Sternum reaching in towards the spine. Shoulders plugged down the back. Chin retracted. These rows, one arm reaches forward as the other reaches back. Head turns with the arm that's reaching back, brushing by the side body. Palms should be facing in towards one another for your bow and arrow rowing and twisting. Finish up your last set, coming up to a tall spine, setting that band to the side. Great work.